Doctor exposes United Healthcare's peer-to-peer review process for approval of a surgery.
Hello? This is Dr. Elizabeth Potter. Who is this? Who am I speaking with? Can you not, sorry, there's also another way. So you have two doctors on the call. Will either of you give me your name or MPI number or license number? The reference number for the call, but you won't give me your name or number, and neither will the doctor from Texas. Okay, please give me the reference number. Okay, and is the doctor from Texas? Would that person speak up, please? I'm good. Are you a plastic surgeon? What do you mean subspecialty plastics? I'm a plastic surgeon. I wouldn't say subspecialty, so. You're an oculoplastic surgeon. What was your initial training in? So we're speaking about lymphedema of the arm, so this is not an area that you're familiar with, correct? Oh, okay. Still practicing, but you won't give me your name? But you're my colleague in plastic surgery, and you won't give me your name. Yeah, I don't understand how it's connected. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema, and I would like to know your name. How do I know who you are? How do I know that you're board certified and that you're a microsurgeon? Like, how do I verify that? I'm just trying to make sure that I'm talking to an expert in this procedure with training that's commensurate with that. How do I verify that? So I can get your name from United Healthcare through this reference number. I'm so sorry that this is to protect you as a doctor. I'm really trying just to do the right thing as a patient. And I also personally have been subject to, threatening communication as well. I just want this to be the right thing. Okay, so I'm just gonna have to trust you. You were asking me as a representative of United to trust you that you're a plastic surgeon and fellowship trained in microsurgery. So, okay, I'll trust you there. So do you perform lymphovenous bypass? Have you performed it yourself for patients with lymphedema? Have you performed it yourself? So have you been the primary surgeon in evaluating and performing lymphovenous bypass for a patient? Even one? You have not. Okay. Do you treat patients with breast cancer currently and do microsurgery like deep flaps or lymph node transfers or lymphovenous bypass? You have a cosmetic practice currently. Okay. Okay. Do you do microsurgical breast reconstruction currently? So you're not doing microsurgical breast reconstruction currently or treating patients with lymphedema currently. Okay, so the patient that we're talking about is a physician, and she is going to have an axillary dissection and radiation, and her risk of lymphedema is, I'm assuming you know. Do you know? Do you know what no, it's important. The specifics are important. Do you know the specific risk? Like the documented risk for her? Like the percentage risk of lymphedema? No. She absolutely will need radiation. If she's having an axillary dissection, she's gonna have radiation. No, so she's been to see us in clinic. She's had further evaluation. She is going to be having an axillary dissection and will need radiation. So do you know what her risk of lymphedema is? Well, I mean, I think this is part of the issue. If you're my peer, then I think you should be able to answer that question, because that's an important statistic, certainly for my patients who have lymphedema. So her risk of getting lymphedema is 40%, and we have the ability to reduce that to 10% using lymphovenous bypass. And that's the information that I want you to carry back to United. And I will do the appeals and all of that, but that's the piece of information that I want you to have going forward. So you don't have the ability to approve it in your role. Okay, for this patient I'll appeal. Again, I appreciate your time. I don't think you're my peer in this area. I don't think that you had the specific details around this procedure. You haven't performed it yourself as a primary surgeon, and you're not actively treating these patients with microsurgery. But I appreciate your time and calling, and I'll continue to reach back out to United. You too, thanks.